watching Let's Chat.
Welcome back to Let's Chat, everyone. I'm Troy Thompson. I'm in studio with Dr. Randy Cooper from Pediatric Dentistry and Orthopedics of Chattanooga. And today we're talking all about one of my favourite things, Invisalign. Welcome to the show, my friend. Nice to see you. Okay, for people who don't know what Invisalign is, explain to them at home.
Sure. Invisalign is a process by which, instead of using metal brackets and wires to move teeth, we use plastic trays.
Yes.
That gently and slowly move teeth from where you're at to where we want you to be. And it's all planned out from the beginning, the end point of what we want it to look like in the end.
Now, explain to everyone at home, long gone are the days where people are really using the metal braces, right? They still get used, but they seem to be less and less because of Invisalign.
That's right.
What's the benefit of it?
The clear aligner market is definitely growing, and it's because there's so much more that we can do with that now. The technology has really evolved to where things that we didn't feel comfortable doing that way, or we didn't feel like we would get the result that we needed years ago. Now we can confidently get that result in a lot more cases.
So I want to explain to everyone at home, because the trays, you have several different trays that come to you, correct?
Correct.
So with braces, traditional braces we'll call them, the metal ones, you would go in and have them tightened or maneuvered. These are trays that people come in and have them changed out, right? And how long would we be doing that for?
Sure. So you're exactly right. With traditional braces, we're seeing you about every 6 to 8 weeks for an adjustment. With Invisalign, the process is all worked out from the beginning, and then there's trays that are there. So we give you a certain amount of trays to send home with you, and you change them every week. And then you come in every, say, 8 to 10, 12 weeks for us to monitor the progress, make sure that those trays are fitting like they should, make sure the teeth are tracking with the trays and the movement is occurring like we expect it to. And then the overall treatment time with Invisalign varies by the case.
Yes,
so
it does.
If it's a very simple case, I mean, you could be done in 4 to 6 months. Versus if you're handling a more complicated case, then it could be up to the 18 to 24 months that you might see with braces. Yes.
Okay, I do want to ask you though, when it comes to Invisalign, is it the similar pricing? How does that work? Is it a case-by-case process?
Definitely a case-by-case process, but to try to get to the answer that you're really getting at, it's a very similar cost.
Okay.
To braces.
And everyone has different pricing, of course,
Sure.
when it comes to the procedure that we're doing on our mouth. When it comes to maintenance, okay, because when we have the metal braces, there's food stuck in our teeth and all sorts of things. Invisalign you can take out to eat.
You can.
And that's one of the benefits, right?
It's most definitely a benefit. So you can eat normally, because you're taking them out to eat, and then you can brush and floss normally because you're taking them out to brush and floss. So there's absolutely a benefit to that.
Now, is it true that I have been told that you can use some bleaching in those trays every now and then as well?
You can.
Not every month.
You can.
But, oh, you can every month as well?
You can bleach with those trays, and that is normally not an issue at all. We're usually, as an orthodontist, we're usually working closely with the patient's general dentist to make sure that that's something that they would want to do and need to do, and sometimes handing that process over to their dentist to actually happen. But it is a safe and effective thing to do.
How do I know I'm the right candidate for Invisalign and not the traditional braces?
Sure. So there's really two things that I'm looking for to decide if a patient is a good patient for Invisalign. One is, what kind of case are they? Are they a very difficult, complex case that might do better with traditional brackets and wires? Or are they going to fit that mold? And the other thing that I'm looking for is there's compliance that's needed with these. Since they're removable, we've got to have a patient that's going to wear those. And typically we need about 22 hours a day of wear for it to be effective. So we've got to choose the right patient that's going to actually wear them, because they work a lot better in your mouth than in your pocket.
I don't want to say that I was a failure, but I really was. Now you say 22 hours, I was like, I'll wear them at night when I go to bed. Do you know what I mean?
Sure.
It does take a little bit of knack to get used to them as well.
Right.
But I actually think they're an incredible system. I've known about them for years and I love them. Thank you so much for coming in.
Thank you for having me.
We really appreciate it. If you want to find out more information, there it all is up on the screen for you. I've been talking to Dr. Randy Cooper from Pediatric Dentistry and Orthopedics of Chattanooga. We'll be back after this short break.